Well, for people who may not be familiar with the PAN Foundation, the PAN Foundation is a national patient assistance foundation, and we really believe that no one should have to choose between their health care and their financial well-being. And we do our work in a variety of channels. What we're best known for are our financial assistance programs, but we also have an advocacy program where we advocate for better healthcare access and affordability, as well as education programs for patients and healthcare providers. You know, we're about 20 years old here at the PAN Foundation, and in that 20 years, we've really been privileged to serve 1.3 million Americans. And we've done that through about $4.5 billion worth of financial assistance. And we service that financial assistance across about 80 disease areas. And those include types of cancer, some chronic conditions, and even some rare diseases. Many people in the audience who are hearing this interview today may really be eligible for financial assistance from the PAN Foundation. And we want to make sure that know that this important resource is available to them when they need it. The PAN Foundation operates a Center for Patient Research, and in our most recent poll, we found that 1 out of 3 U.S. adults actually needed financial assistance to take care of their health care costs in the past year. And that's a shocking number when you think about it. That's almost 1/3 of U.S. adults needed some assistance. But only 20% of those actually reported being familiar with financial assistance programs like the PAN Foundation. So that really made us begin to think, wow, we have a lot of opportunity here to grow awareness. And the results of that survey also showed that many people suffered, their mental health suffered due to the challenges they had with that access to health care. And more importantly, we know internally from working with our patients that 90% of our patients who receive financial assistance from PAN report that it has a positive impact on their health outcomes, their overall quality of life, and their outlook on life. So with that low awareness and the impact we know we can have, it became really clear to us here at PAN that we needed to hit the road and do interviews like this to really bring information to people all across the country that financial assistance programs like ours are available to help them when they're diagnosed with these diseases. PAN has a pretty broad spectrum of diseases that we fund for financial assistance. Over 80 disease areas, but today we have 30 funds that actually have funding available. So those can be anything from cancers to chronic diseases and, like I said, even rare diseases. That financial assistance can help you pay copay expenses, can help pay premiums for insurance, as well as transportation costs, because often people will need to go between specialized treatment centers and home, so we can cover those transportation costs as well. So for example, if you know someone who may have a type of blood cancer, whether that be something like chronic lymphocytic leukemia, which is CLL is often referred to, or a disease like Waldenstrom's, they could be eligible for up to $4,000 in financial assistance from PAN today. So we encourage people to really check out our website at panfoundation.org/assistance to see which disease funds are open, if they match your needs, and then to request to participate with us. So our disease funds operate as we have resources and funding available to them. So our disease funds will open and close from time to time. As I mentioned earlier, we have 30 funds that are currently open. And if a fund is closed, we encourage you to sign up for our disease fund wait list. That disease fund wait list puts you in numerical order on a first come, first served basis. And when funding becomes available, you'll receive an email from us that funding is open and you can come in and apply. But if an existing fund is open, there are a whole variety of eligibility requirements that can be found on our website at panfoundation.org/assistance. But generally, there are a couple of criteria. You need to have the disease for which you're seeking assistance. You need to actively be treated for that disease. And then we have an income threshold, and it's roughly around 500% of the federal poverty level. But since most people don't know what that means, to break that down, for a family of 2, if you make less than $105,000 a year for a family of 2, you would still be eligible for assistance from PAN. So often people will think, well, maybe I make too much money, I don't really qualify. And we encourage you to come to the website, Check it out. There's a very nice eligibility wizard on our website that will help you figure out if you're eligible for funding or not. And it's a first come, first served basis. So if you are eligible, applying is really easy, and you will find out within a matter of minutes whether or not you qualify for the grant. So the PAN Foundation, as I mentioned, works in several areas. Financial assistance programs clearly is our largest area of work, but we also have advocacy programs and grassroots advocates all across the country that work with PAN to go to Congress and write Congress and communicate with legislators and administration officials, really to adopt and pass policies that improve healthcare access and healthcare affordability. We also have education programs, and on our education side for patients, it can range from really complicated topics like what Medicare Part D reforms may mean for them, and that is one of our programs that we have available, all the way to how to navigate and financially manage a chronic or life-threatening illness. That's also one of our programs. Even to clinical trials. So some people have lived with the disease for a long time and may be interested in clinical trials. So we have an education program where you can learn about clinical trials, how to participate, what kinds of questions you should be asking, how to talk to your doctor about it. So really, when you look across the spectrum, we do our best to support patients in a variety of aspects, from immediate financial need to their education to help them manage their disease long-term, all the way to advocating for policy change so that hopefully others in the future don't need the same kind of assistance. For more information, I would encourage you to please go to panfoundation.org/assistance, or you can call us at our call center. We have a call center that is staffed with amazing patient support specialists that will walk you through any questions or application processes that you may need to undertake. And they can be reached at 1-866-316-7263. Again, that number is 866-316-7263. And that call center is open Monday to Friday, 9 to 5:30 Eastern Time. And we look forward to hearing from you.